COVID may no longer be in the national headlines, but it's an issue that isn't going away. And with so many tests being done at home, one way to help track community spread is by testing wastewater. As Pat Bean reports, that's something Bloomington has been doing since the early days of the pandemic.
So I've got our jar of raw wastewater here. I'm going to go ahead and just shake it up a little bit, not too vigorously.
Nick Komasinski is preparing a sample of Bloomington's wastewater to be sent off to a lab in Tennessee for analysis.
I'm going to take this and just pour on in.
Komasinski is part of a team at the city's Dillman Road and Blucher Poole waste treatment plants that collect wastewater 3 times a week to be tested for COVID-19. The wastewater is poured into a 100 milliliter bottle, tested for pH balance, and its temperature logged.
When things are stabilized, you should see that check mark appear, and then I will press something on screen to freeze that result, and then I'll go ahead and enter the data over the phone.
The bottle is then put in a cooler and shipped off for analysis. One of the samples, collected on Mondays, is sent to Microbac Laboratories. That data is used by the city. Samples are also collected Tuesdays and Thursdays and sent to a lab in Boston to be entered into a national database. Jason Winning is the pre-treatment coordinator for Bloomington. He oversees the city's industrial and commercial wastewater programs.
It's an interesting data set, and we're glad to see it growing. It's something we've been working on for, we're going on 2 full years now, which is going to be a pretty robust data set.
But the data, for now, can't be used solely to guide the city's COVID policy. That's because the sample size covers a large area, and it can take a couple days to get the data back from the lab. But it can be used in conjunction with hospitalizations and other indicators.
It is a great tool to get that early data. And so if you can get that turnaround time down low, you can get a heads up of 3 to maybe up to 11 days advance notice of what you're seeing in those the trends of community spread.
And those few days of warning can help a community decide to increase testing, suggest mask wearing, or give healthcare systems a preview of what's coming.
Also, you can use this to tell us when we've peaked, when we're on a decline. And that's really informative too.
Bloomington has been at the forefront of wastewater COVID testing. The city began exploring the process in June of 2020, and that month joined 13 other communities in the state for the Indiana Wastewater Monitoring Program. Funded by the Indiana Finance Authority, the program allowed the city to test 8 sites twice a week. Doing that much testing confirmed spread at a neighborhood level that mirrored COVID testing results.
We saw very matched up data, at least in the trend line, of cases within our student population, especially in the fall of 2020, especially around the dormitories and the housed organizations, the Greek houses, and what they were seeing in those same neighborhoods that they were collecting in. So that really showed us the potential of it.
But that program lasted only until the end of 2020. Since then, the city has been footing the bill and cut back testing to just once a week at the 2 treatment plants. Winning says testing will likely extend through the end of 2022.
This was important for us to get out in front of, to try and gather data wherever we could. Sampling for COVID and wastewater-based epidemiology, as a practice, was incredibly new at the start of the pandemic. Still very much a fresh field.
Fresh is what you would call the pool of wastewater the samples are taken from. A unit where the water enters the plant collects a small volume of wastewater every 15 minutes over a 24-hour period. At the Dillman Road plant, that time frame is midnight to midnight and is collected daily to test the water for EPA and other regulations. The same water is used for COVID testing.
For the team that's been working on it here, we're very proud about that, and part of working in wastewater is public health, and we're happy to contribute, however we can to that.
McKean says IU is looking to partner with CBU to provide wastewater testing, which could increase the number and frequency of sites being tested and improve the turnaround time of the results. For Indiana News Desk, I'm Pat Bean.
The city pays $479 per sample sent to Microbac for analysis. The CDC covers the cost for samples sent to it.